Hello everyone. Now I'll discuss question of neurology. So we have a 55-year-old male. He comes to you with complaining of involuntary shaking of his hands. It started on the right side, but now left hand shakes as well. Shaking disappears with the purposeful activity and worse with emotional stress. He doesn't have a very any family history of tremors, and the resting tremor have a frequency of 4 to 5 cycles per second, and some rigidity is there. Gait is and posture are normal. His mini mental exam yields score of 30 by 30, which is absolutely perfectly all right. Most appropriate treatment for this patient is. The answer to this question is trihexyphenidyl. First of all, main complaint is tremor for which patient has come to you, and as we said, it started from one hand, went to other hand, is most likely due to early stage of Parkinson disease. Classically, the tremor of Parkinson, they occur during rest and they improve with activity. In this patient also, patient had a resting tremor, but when he is doing some work, the tremor disappear. Okay. So you can say Parkinson are so-called resting tremor. Now I have a question for you. Stop the video, write down the answer. Tell me any condition where we get intention tremor. That means tremor are more in activity, less in resting. What is that condition? Stop the video, write down the answer. Well, the answer is cerebellar disease. Okay, so we come back. Now, even essential tremor also have the opposite effect. The other condition where we can have is essential tremor. Okay. That means essential tremor, they are more in activity, less in rest. Well, in Parkinson, the frequency is 4 to 5 hertz per second. Same is in our patient also question. And it is often first seen in the one hand of the Parkinson disease, and it is a early feature also. So tremor often involve one hand before it goes to, as I told you in the previous slide also, before it goes to other, or you can say initially it is asymmetric, later on it can become symmetric, both hand also. Rigidity is a classical feature. In fact, 1.1 we say rigidity, that means we are dealing with Parkinson disease. Why it is so essential to lay a stress on this particular word? Well, we talk about tremor in essential tremor, we talk about tremor in cerebral disease, etc. But none of the other conditions have this rigidity. If so, you are dealing with tremor and rigidity, that means you are dealing with Parkinson disease. Quite 99% you are sure about it. Well, in this patient, postural instability is not there, gait abnormality is not yet in this patient, because our patient is in the early stage, they are the late features. They do happen, but they are late features, point to be noted. Now, there are wide variety of medication we can use, okay. Well, as far as in this case, our answer is anticholinergic drug is the best answer for our patient. Why? And anticholinergic in this trihexyphenidyl is the option that we have in this. Well, it is specially used in those patients who younger patient below 60 year. Our patient is below 60 year, and where tremor is the predominant complaint. Symptom is tremor, like in our patient. So this is ideally suitable for these patients. And above 60 year, it is not very preferred because it has got lot of side effect due to anticholinergic action. But our patient having below 60 year, having tremor is the main symptom, then beyond doubt, no doubt, anticholinergic drug, trihexyphenidyl is the drug of choice in this case. Now let's look into other option. Clonazepam is a second-line treatment of essential tremor, and other medications are preferred due to abuse potential of benzodiazepine. So it definitely it is not a treatment of Parkinson. As far as clozapine is a use for essential tremor, but it is not a first-line treatment for essential tremor. Primidone can be used in treatment of essential tremor, sometime in combination with beta blocker. So what we have seen, this option and the previous two options, they are the drug for essential tremor, but again, none of them is a first-line treatment. Then what is the first-line treatment for essential tremor? Propranolol is considered as the first-line treatment for essential tremor. But now it has made our question easy. That means out of all the 5 options, only one option which is given in Parkinson is trihexyphenidyl. Okay, so other 4 options, but we are all are for essential tremor. By rule of technique also, that only drug that is available for Parkinson disease was trihexyphenidyl. But now I change the question. If the option contain other like dopamine, carbidopa combination or amantadine or any other thing, then again out of all these drug or the anti-Parkinson drug, so again repeating second time, drug of choice for essential for tremor in a patient below 60 years in Parkinson is anticholinergic. So golden line to remember: Parkinson disease should be suspected in a patient with resting tremor of 4 to 6, asymptomatic and associated with rigidity, strong pointer toward Parkinson. Tremor is often presenting symptom of Parkinson. Trihexyphenidyl is an anticholinergic drug, sometimes used in the treatment of Parkinson disease, generally in younger patients where tremor is the main complaint. Thank you very much.